Sego, Dr. Paul, good morning.
Good morning. Good morning.
How are you this morning?
I'm fine. I'm fine.
Good.
Just the Monday, Sunday, Saturday, same to me.
Pretty much,
It's kind of
yes.
pretty much for all of us, eh?
Yeah, no, I hear you. My apologies for being a few minutes
Oh,
late.
no
We're
problem.
running a bit behind schedule, so I am joined this morning by all members of my council from each of the districts. So thank you for joining us as well. We have our executive director, who is the senior administration officer here at the Mohawk Council. Our who is Heather Phillips, excuse me. Chelsea Francis is our government service manager, and Kyra Schulze is our recorder, executive assistant for today's meeting. So I don't know if you've prepared a presentation of such, but I
Yeah.
think that it's important that you provide us with an update of where things are at, and then hopefully we'll have a few moments later on for some questions. So I'll turn it over
Yes.
to you.
Thank you. Thank you very much, Grand Chief. And it's a pleasure. I've actually offered to present to all our councils, and this one was included. And this is my 9th or 10th one that I've done now. And so the Grand Chief has seen some of the presentation that I'm going to show you, but I have some updated slides that will be new to him as well. I'm going to give you, I'm going to try to be brief, but I'm going to give you an overview of where we are locally, and focusing on Eastern Trail Health Unit and obviously in Akwesasne as well. I'll give you a very quick overview on where we are provincially, because that drives some of the restrictions and so on and decisions. And then I'm going to finally talk a bit about vaccines and specifically hone it in on Akwesasne's vaccines and so on. So let me I'm going to share my screen right now. I'm just going to give you a bit of an overview of here we go. So just statistically where we are. And just want to make sure you're seeing the screen. You see the number
Yes.
542 there? Okay. Sometimes with Zoom, when I'm a visitor, it doesn't work. So I just want to make sure this time it worked. So just to give you an overview of, I'll focus in on Akwesasne, but the health unit itself, including Akwesasne, had a relatively quiet spring and summertime. And as I'll show you right now, we've had a ballooning increase of cases. Right now we're at 2,333 cases total, and I'll focus in on Akwesasne. I just want to give you the context. And we have 542 active cases in our area, over 30 of which are in Akwesasne actually. But just to show you, around early September, we were at barely 200 cases in the whole area, the whole Eastern Trail Health Unit, including Akwesasne. So right now we've got 21 patients hospitalized, 5 in the ICU. We have multiple outbreaks, including two in Akwesasne right now, in long-term care and your retirement homes there as well. And I'm just going to give you sort of where are we here? Okay, summaries. Here we go. So I just want to show you the sort of the trajectory we've had in Eastern Trail Health Unit overall, and then it's kind of the same all over. And we've got Akwesasne here now, and you could see, the numbers have sharply increased compared, in terms of what we had here. So right now like I said, we're at 31 active cases in the area of Akwesasne, and you could see how we have a sharp uptick, and that's an uptick that we've seen, like I said, in all the EOHU area as well, and of geographic significance, right across the river from you as well. We've got a marked increase in Cornwall as well, and if you look at our map. If you look at our map here, that we've sort of mapped everything out now, you could initially, when we first started with the pandemic, the Prescott Russell area up here was actually much higher than the lower, like SDNG Cornwall in this area here, Akwesasne. And so that was because we had a lot of people that worked, that lived up here and worked in Ottawa. So it kind of reflected the Ottawa picture. But now we've kind of seen a reverse where we have a huge increase in our numbers. Like I said, even Cornwall, and again, I'm saying it relevance because it's really right across the river for you. And, you back, a lot of people go back and forth to shop and so on. So the numbers going into the spring, in the spring, we had 35 cases in Cornwall. And going into the September, October months, we were barely at 50. And so it's gone up tremendously. Most of our active cases are literally in the SDNG area right now, lower here, like Glengarry, Cornwall, and then 31 in Akwesasne as well. Now, the numbers in Akwesasne are up because we are skewed a bit because we've had some outbreaks and we've had residents and staff in the long-term care home, in the long-term care home have been positive, but still we've seen an uptick in that. Now, and in terms of just sort of the demographics, I'll show you. Basically, this is the Akwesasne. So, and we're seeing the same picture throughout. It's more female than males. In Akwesasne, it's the same pattern, more females than males. And if you look at the age groups, again, in Akwesasne, we're seeing a pattern that we've seen. So the orange here and the blue are less than 40. So 58%, which is what we're seeing across the province, are less than 40. And then we're seeing the rest in the older age group. Now, the problem is that ordinarily younger individuals will not have the complications or the consequences that we'll see in older individuals, but they just these kids or younger individuals are fine, don't have major symptoms, but spread it to the elderly, and that's what we're seeing. So what we're seeing now, an increased trend towards more elderly getting infected because it's a higher kind of what we call transmission rate. And I just want to show you one more thing here. And this is just the EOHU area as well. We don't have the Cornwall number, the Akwesasne numbers in here, but it's similar pattern. If you look at trends, these are the rates that determine the high transmission level. So if you're over 40 means 7-day cases per 100,000, the previous 7 days. And if you're over 40, which by extraction, I'm sure Akwesasne was over the last week or so, you're kind of what we call the red zone, which is again more restrictions, but all that means is that there's higher level of transmission in the community. That's what it means. And it doesn't surprise us then that when you have higher area of transmission around you, it gets into the homes. So, we've had the 2 outbreaks in Akwesasne, and then we've had 13 others, around the area. And again, the higher outside, the higher inside. And that's why it's very important for us to do that. I'm going to give you I'm just going to now switch over to a quick PowerPoint presentation, if you don't mind. And it'll end up with the vaccines as well. I'm just going to share now again. My PowerPoint, here we go. So this is, I'm just going to show you, these are provincial trends. You see the graphic here? Okay. So this basically shows provincial trends, and this is the week of, this is 3 weeks ago. Which one is it? Yeah, this one here. So this graph here shows you all the numbers in Ontario. Remember I talked about the 7-day, it's called the rolling average, a 7-day per 100,000. And this shows you the trends that we're seeing in the province. And we started to see a bit of a decrease here. Eastern, our area here, was really among the top 7 or 8 in the province. Certainly not as high as Windsor, not as high as Peel, but you can kind of see a bit of a leveling off there. And then if you go to the next one, this is a following week, which is a couple of days later, where you see it now starting to go down a bit. Okay, you're seeing it starting to go down. And then finally, this is the latest one that we're seeing, which is literally last week, where you can actually see the numbers really start going down across the province. And it coincides with, we had a lockdown December 26th, and now we had a shutdown a bit later. So now you could see the provincial trends, including ours, were going downwards. Just to note that we're much higher than Ottawa is, just to show you now. It's usually Ottawa's higher than us, but we're higher than Ottawa. So I just wanted to give you a context and show you that our numbers too, I forgot to show you on our previous graph, our numbers are going down as well in terms of trending downwards, which is a good news. And it's happening provincially and locally as well. So the message is it's starting to level off and go down. The reason that we put these is because even our hospitals, our Cornwall Hospital, out of the 25 patients that are there, that are hospitalized in our area, more than half are there, and most of the ICU ones are there as well. So our hospitals now are working at 100, like Cornwall Hospital is about 120% capacity, has room to grow, but we don't want to push it to the limit. And that's why the shutdown was put in, to protect the healthcare system and to help decrease that high number. You can see how high they were here. In terms of, this is a higher, look, red is considered high transmission. I mean, this is like ultra high transmission up here. And so that's why I just wanted to show that to you, and sort of on a provincial context, just to show you again, our area here. This is the number 146, which is 7-day average. And you could see that the area between us and GTA is yellow, and that's why this school's open there. Our schools did not open. And then, but the good news is that you could see, we were 146, and then now we went down to 140 the previous week, and then last week went down to 114. So it shows that we're going down, but we're still in the red, quite high, right? Like high 40 is red. We're 114 right now, which is better than it was before. So I just wanted to show that to you a bit. And I also want to now go down and just show you a few other, just another slide that I think is important. The other indices of like percent positivity is another indicator of transmission in your area, and our numbers are going down steadily as well in terms of numbers of number of people tested who are positive. At one point we were at 7.5%, and just to give you context, you're in the red if you're above 2. So right now we went down from 7 to 5 to the most recent one, which is 3.2. So that the numbers are going in the right direction for all of us here. What this shows here is the tendency for how the infection, how people deal with that, and about 2/3 of the population, follow public health measures, about 1/3 don't. This is what the slide shows. So it's that third of the population that they go to work or they hang out with a friend and don't wear a mask and don't physically distance. Then they come home and they infect the whole family. And that's where we get elders getting infected. That's where we get kids getting, all get infected. We've got cases where, one individual went to work, did excellent, did very well with the staff and with, the public. But then in the back in the kitchen, they were eating together and they went out to smoke together, they carpooled together, no masks. And then one of them got sick a day later, but infected that individual the day before, because you could be contagious 2 days before symptoms start. And so then each of those individuals went home and infected their whole home. That's what we saw. So it's an infection that way. And so now, as you've heard, there's a variant of the virus that has mutated and is actually more easier transmitted. So it's even more important for us to adhere to those. And that's why the shutdown and the lockdowns were implemented, to be able to at least control it. And it looks like it's working. Again, it's at a high level that we're leveling off at, but hopefully over the next couple of weeks, we'll see a downturn as well. So that's a piece of good news. I'm cautiously optimistic that the numbers are starting to go down, but we still need, and I talked to all the councils to spread that message that, hey, we're there, we're leveling off, but we still need to continue with those measures. And then the other issue is the vaccine. So that's another positive thing that we're seeing, albeit we're struggling a bit now because of vaccine supply. Back in the fall, people were asking me about when's the vaccine going to come out? When's the vaccine going to come out? And I said, well, likely in the spring, because that's when, so we're lucky we got it a bit earlier. So I just wanted to give you the overall phase, and then I'll go down into where we are with Akwesasne and other First Nations in the province. So our first and main priority was to vaccinate seniors, living in long-term care and retirement homes, and staff and essential visitors, and then healthcare. And at the same time, that's phase one. It's kind of sequential, being healthcare workers, First Nations obviously is there, and adults in chronic home care recipients, and then we would shift it to essential workers, and adults not living in congregate living sessions. So where are we now? We are now in the face of struggling with vaccine supply. As you may have heard, there are 2 vaccines out there. One is Pfizer's, and which is very difficult to transport to maintain. You need a -70 freezer, and the other one is Moderna, which is a bit easier to transport. Both need 2 doses. So based on those, the projections are that we get all this done here by end of February, where we'd have this population, the phase 1 population, taken care of February, March. And that's based on only 2 vaccines. We should be getting a 3rd or 4th vaccine over the next couple of weeks. So I think the numbers will make it easier for us to vaccinate people quicker. Now, when it comes to First Nations and Akwesasne, most of the vaccine that was allocated for First Nations has gone up to the fly-in areas, and areas like Akwesasne, even more north, like Kenora, Thunder Bay, have not received vaccine for First Nations, which I don't understand. But I spoke to the ministry, and we got a specific allocation that I'm happy to say that you were able right now. Keith and his team were able to vaccinate both your retirement and your long-term care home. Both have been vaccinated, despite the fact that they're in outbreak. It doesn't matter. They were vaccinated, and we have a second dose ready for them as well. I'm meeting today. We're meeting with the Ministry of Health and the Ministry of Indigenous Affairs, Batista, Deputy Minister Batista, today at 1 o'clock to ensure that we have a better understanding of what vaccine supply is going to come to First Nations, but specifically from my point of view to Akwesasne, that we will then be able to help plan for a bigger rollout in Akwesasne. We in Eastern Ontario had not received vaccine up until the second week or third week of January. Second week of January, most of the vaccine went to Ottawa and went to Toronto, and so I was very upset. And we did get vaccine as well. And we were able to vaccinate not all, but most of our long-term care. But there's a separate allocation that was already being administered in Akwesasne. So at least that population is taken care of. But I will, like I said, I will have more news today at 1 when we meet to ensure what are the allotments. And the rate limiting factor is that the companies are just revving up their production, and that's the frustrating part. Is that we're all ready to go. We're all ready to go with vaccinating. Your team is ready. We're ready to support whatever is required. It's just that we need the vaccine. So at this point, I'm happy that at least we got the priority populations done. But but the phase 1 includes for Akwesasne, in my mind, and I know that fly-ins required as well, but so do others, and they're in the swath. So I just wanted to let you know that I'm the one that I wanted to make sure that this was on the table, and so we will be talking with them today at 1, and I will get back to Grand Chief right afterwards to give him an update along with Keith. Just want to tell you as well that Keith Leclerc and his team, his associate director, and has been part and parcel of our planning committee, our pandemic response committee from the beginning. They're part of our IMS structure. We used to meet daily. Now we meet 3 times a week. And ad hoc as well. So that's going very well. And we're sharing information. We're sharing protocols. All the medical directives that I sign are for Akwesasne nurses as well, and so on. So that's all settled. If I know that Keith had said he wanted some help for vaccinating and support for the second dose, because don't forget there's 2 doses of Moderna, the vaccine, and so we're ready to support that as well. This weekend, there was an outbreak in the retirement home with 1 staff being positive. When we call an outbreak, we call it one person, just 1 case. We call it an outbreak. Normally, you need 2 cases to be linked, but because of it's COVID right now, the new guideline is it's 1. And so I know that Keith reached out to me over the weekend, and there's a lot of contacts and tracing. So we're going to help out with that contact tracing. To tell you as well, we have been inundated with cases. Like one weekend, we got 145 cases in 2 days. And we're a small health unit. That was more than Ottawa got. Ottawa gets 90, and there are 1 million people. And so we were inundated. So in any case, I understand. So we will be reaching out. And like I said, Keith and his team are part of our team in terms of planning and support. And so I do understand. And Grand Chief, I understand that the United States side is a bit different. Like they've received many more vaccines than we have, as you know, in Canada. They received like 40 million, and we've received, I think, in Canada, 200,000 or something. Like it's very little number. It's a very low number, disproportionate. So it's a matter of time. I think that but in the meantime, I would just ask that the council reinforce the fact that we need to do the physical distancing and so on. So Grand Chief, I'm done with my presentation. I'm be very happy to answer questions.
Absolutely. Well, thank you for that very good information. Are there any questions for Dr. Paul this morning? Carolyn, and then I see Vince.
You're muted.
There we go. I just have a question. How safe is the individual that received the first part of the vaccine? I'm talking about Yakisutta. And then they got a staff person that got sick. So how protected are the elders in there with just one part of the vaccine?
I'll tell you, I got the stuff. Actually, I was told that on Saturday. We had a meeting with the council, and I got the number right here, and it is actually pretty. First dose is about 90% effective. 90% effective. Now, it may be a bit less in elders, but it does give you a significant protection. That's why it's important, even though we had one vaccine, even two vaccines, until we get a lot of people vaccinated, we still need to do PPE and all that other stuff that we're doing. Okay, it's very important. That's another message that I want to get. I forgot, but that reminded me that we need to get that message out that we're only vaccinating a very small proportion of the population, and we're vaccinating the more vulnerable ones. So so it is about a 92%. I would bet you it's somewhere between 70 and 92, because I know an elderly gets a bit lower. So at least there is a bit of protection, but we can't count on that. We need to do that's why we call an outbreak. We do the whole as if everybody was infected. We act to protect everybody.
Okay, thank you. Vince, we'll go to you.
Yeah, some of my questions is around the area where we had this past Friday with the tribe was how long is it the COVID how would you say
Contagious
in your system? How many days?
10 days. 10 days.
Okay, and how many days does it take to get a negative result after you test positive?
We don't. The thing is, we don't test positive anymore, because you could be positive for 3 months, but that doesn't mean that you're infectious. You see, when the test that we do just measures the material of the virus. It doesn't tell us. So we know that they did studies it's 10 days. It used to be 14 days, but now we know it's 10 days. So we consider a person non-contagious 10 days after. But let me confuse you a bit here. The incubation period, the period with which it takes for you to develop the infection, can be up to 14 days. So let's say now somebody was in contact with somebody that had COVID. That contact needs to be isolated for 14 days, because it takes 14 days to develop. Once you develop it, then it's 10 days you're contagious. So people were confused about those two notions.
Okay. Okay, thanks for the clarity.
No problem. Connie, we're going to go to you.
Good morning, Dr. Paul. Thank you for coming to speak with us today. I just have a couple questions, and I understand that you have been meeting with our representatives for some time, and thank you for the guidance you've been providing. As you are aware, based on what you just showed, our numbers have been increasing drastically since mid-October. And unfortunately, we lost some members.
Yes.
And
yes.
I understand that, as you mentioned today, you are attending a meeting, and you too have been upset with the fact that certain areas are not receiving vaccination or vaccines as quickly as we had hoped. Though we can look at Ontario, Eastern Ontario itself is much larger than Akwesasne. The numbers are much larger for population. So when you look at Akwesasne, you can see that we're in dire need, and I will say dire need of vaccination soon.
Yes, I agree. I agree with that.
Yeah, because our population isn't as big as others, so that ratio of how many we have and the being above 40, we should be alternating our.
You're very high. You're very high. You're really higher than 40. I know that, and that's why you're closer to the higher range. And I do agree. And even if you weren't, I know that there's a higher risk. You know, there's a lot of underlying risk in Akwesasne like we had with H1N1, if you recall, we had a lot of individuals that were sick, and so I do believe that that's why I'm meeting them today, because I pushed the envelope and I said, no, listen, we need to have, you know, something planned, because we need to prioritize them. The government put those in the priority. You need to follow your priority, right? It's
Right.
you saw it clearly. It's in phase one. It's not phase three. It's phase one, and
Yeah.
we're in there now. But I must tell you that it's a bit of a struggle, Chief, because we've been meeting with the general and all these and with all the task forces and so on, and it's because I see the numbers, like they're so low in terms of what Canada has gotten. Forget about even Ontario. Like this week, we were stunned because we were told we were going to receive, you know, a certain amount of Pfizer vaccine, and then Pfizer is not delivering any vaccine to Canada this week. So it puts that, you know, it puts that in, but that's still, but we still have Moderna. Like Moderna is going to be the one that we'll be using more in First Nations, because it's easier to transport and it's easier to manage, and so I'm hoping, like I said, and Moderna does deliver consistently. So it's just a matter of getting it down and making sure we have a timeline so we can have it ready to go. Like I said, the teams are ready. You know, Akwesasne is ready to go with whatever is needed. You know, starting with, you know, there'll be an internal prioritization, how you roll it out, but it could be done. It's a matter of having it in our hands. That's the problem.
Yeah, and I know that sadly our numbers support that need now. So when you mentioned earlier, you spoke of implementing more restrictions based on reaching that red zone. What would you recommend as
At this
stricter?
point, I would recommend what we do in Ontario, what we've done in the rest of Ontario, which is the shutdown, which is retail only essential. Stay at home as much as you can. The chief, Grand Chief, you have the order. You have the actual regulation. Yeah. So it's basically stay at home, only go out for essential services. In terms of retail, only allow essential, like grocery stores and those type of things to open. Other retail can be just curbside pickup. And that was implemented in Ontario last Thursday. It's going to be 2 weeks on Thursday, and it was implemented for a month. And we looked at schools as well in areas that were very high. I don't know, Grand Chief, did your schools reopen?
No, they're all virtual.
Okay, they're all virtual. Well, I would continue that, because we did not open ours as well in our area because of the numbers, and you're at those levels as well. So they would go until at least February 11th is what we had thought. Because that's kind of where we're trying to see. And as you could see, the numbers are starting to go down, and I'm hoping that we can get the same downward trend for Akwesasne as well, that we'll see over the long run. But in the interim, that's what we need to do. So it's stay at home. The most important one is the mingling, and also people to being aware if they have to go to work, and then work at home if you can. You know, that's the other thing as well. It depends. Like our nurses who are vaccinating, or your nurse who are vaccinating, can't work at home, right? But some people can. So the less people that are intermingling, the less that the virus has a chance to mix, and that's what we want to do. And then the other message would be, if you're going to go to work, make sure you take the precautions at work, because people tend to be lax with those, and that's where we're seeing those gaps, those blind spots that I call them.
Yeah. Okay. Thank you. I think we're actually doing a lot of that now too.
Yeah, I'm pretty sure you are. Yeah.
Okay, thank you. We have Tim, and then we're going to have to wrap up. We have only so much time with Dr. Paul.
Good morning, Dr. Paul.
Good morning.
And thank you for all your work and your help with Akwesasne especially. So I have two questions. So the first dose of Moderna was given to the homes. When is the second dose to be
28
given?
days. 28 days. So
Okay.
we're working with that schedule, so we can make sure that we give it at 28 days.
And my second question is, so if a resident is positive and they're still eligible for the vaccine, and how does it affect them?
Okay, we believe that we would have to wait the 10 days, but you could wait 3 months to vaccinate them, but there's no reason not to vaccinate them before 3 months, but after 10 days. So that's how we were working with the residents when we did the first home. Okay. Because just to get you back, the coronaviruses are very, very unique viruses in that when they infect you, they don't induce big immunity. They don't induce big immunity. So other viruses, once you get infected by that virus, your body reacts so aggressively that that virus will never be able to get you. With this one, with the coronaviruses in general, what we believe is that they're not, it's called immunogenic. They don't stimulate your immune system as much. So you don't have maximum protection against further infection probably down the line. And so the vaccine boosts that, if you think about it. Okay.
Makes sense. Okay. All right. So thank you very much, Dr. Paul, for sharing this information with us today. And on behalf of myself and our community, thank you for all the support you're providing to our community, to our staff, to the health unit here at the MCA. I know it's been extremely challenging for all of us and across the region, but now, you know, that we hopefully are going to have a successful rollout, and that the government will, you know, get the vaccines to us as quickly as possible. But appreciate your advocacy at the regional level, and not one meeting goes by that I don't let the bureaucrats and the elected officials know that we need the vaccines in hand, because everybody wants to help us. We have the common challenges as the rest. Our staff are tired. We're having a hard time finding nurses, and we need vaccines. That's the message we've been sending.
I hear you. I hear you. Hopefully, I'll get some little headway at one today.
Yeah. So I thank you for that. So okay. Well, thank you very much, Dr. Paul.
Thank you very much, everyone.
Have a good morning.
Thank
and
you.
We'll talk to you
Thank you,
soon.
everybody. Thank you. Bye-bye.